We're going to take about 5 minutes and we're going to talk about assist control mode of ventilation. It's often abbreviated as AC. This vent actually calls it CMV, which is technically an outdated term, but it's all talking about the same thing. So in assist control mode of ventilation, you're going to set 4 major things. You'll set your FiO2 and your PEEP, which control oxygenation, and you'll set your respiratory rate and your tidal volume, which control your minute ventilation. Now FiO2 and PEEP, we have an entire video dedicated to just oxygenation. I'll encourage you to review that. All that I'll add here is have a PEEP table. As you go up on your FiO2, go up on your PEEP, and use the lowest possible FiO2 to oxygenate your patient. Rate and tidal volume, again, these control your minute ventilation. And as we know, minute ventilation controls your carbon dioxide levels. So as you adjust these settings, you'll adjust the carbon dioxide levels on your ABG. So we'll go ahead and go to the vent and see what this looks like. First, we'll go to CMV mode on our vent. Again, it's the same as assist control. We're going to set our FiO2. Again, we're going to go as low as possible to maintain our SAT. Jeff has healthy lungs, so we'll go to room air. We'll set our PEEP at 5. We'll set our tidal volume based on his height. Again, we've measured him beforehand. He is 70 inches tall. When we look at our tidal volume table, his max tidal volume is 580 mLs. That's a max that we don't want to go above, so we'll start below that at 500 mLs. We'll set his rate. Typically, I start a respiratory rate at around 16 to 20. If he's in severe distress, you may need to go higher. If his lungs are healthy, you may be able to get away with a lower respiratory rate. So, assist control, we set this rate of 16 and this tidal volume of 500. Jeff, I don't want you to initiate any breaths. I want you to let the vent initiate all the breaths. So with this respiratory rate set, this is a minimum where he cannot go under. So he's going to get at least 16 respirations a minute, no fewer. The question is, what if he starts initiating some breaths on his own? So you can see here, he gets the breaths, then mandatory. Now Jeff, I want you to go ahead and start breathing a little bit faster for us. So as he breathes faster, every breath gets this minimum tidal volume of 500 mLs. Every breath is a vent-controlled breath that gives that set tidal volume. There's no spontaneous breaths in assist control mode ventilation.
So let's look at some settings and an ABG to test our understanding of this mode. So I've got my patient in assist control mode ventilation. Set respirations are 16, my tidal volume set at 500. However, my patient is breathing 20 times per minute. And I get this ABG back. And I want to get that CO2 down. So what's the best way to get that CO2 down? Well, usually we want to go up on the respiratory rate because, again, high tidal volumes are harmful to patients. So what happens if I change that set respiratory rate from 16 to 20? And the answer is nothing. My patient is already breathing 20 times a minute, and every breath is guaranteed that set tidal volume of 500. So if I increase that set respiratory rate from 16 to 20, the minute ventilation will not change. If I want to change the minute ventilation by adjusting the respiratory rate, I have to go higher than my patient's total respiratory rate. So a hang up some physicians have with assist control mode ventilation is they state that if your patient needs additional volume higher than what you have set, they're not going to be able to get it, or it's going to increase their work of breathing significantly to get that extra volume. We pulled a clip out of the previous video. This is when we first changed Jeff to assist control ventilation. You can see there the tidal volume is 380. What I want you to look at is the exhale tidal volumes that he's actually pulling. You can see there that one's low at 268. The next breath is 671. The next breath is high as well at 716. So you can see he's getting significantly higher tidal volumes than what we have set. Now in some older vents, this will be the case. Your patient will be locked out at volume of whatever you have set. But most modern ventilators, especially if your ventilator allows you to set an inspiratory time rather than an inspiratory flow, will allow your patient to take as much inspiratory volume as they want, and it will not increase their work of breathing. So let's review one more time. In assist control mode of ventilation, you set a respiratory rate, a tidal volume, a PEEP, and FiO2. PEEP and FiO2 go as low as possible to maintain that SAT of 90. When you set your respirations and tidal volume, that's a minimum for the patient. Here we have 16 set. The patient will never get fewer than 16 respirations, and all of his respirations will be at that set tidal volume of 500 cc's. Any additional breaths he takes will also be at that set tidal volume of 500 cc's. Our patient will never be able to take a tidal volume of less than 500 cc's, as that's what we have set on the ventilator. This differentiates it from other modes, specifically SIMV, which we'll look at in just a moment. This has been a review of assist control mode ventilation in about 5 minutes.